Welcome to our discussion today. We have a very hot topic. As you can see, what's happening around with this COVID-19 virus and in which kind of predicaments it's placing us. I'm Dr. Pavlovic, completed medical school in Aachen, Germany, received the medical degree and doctoral degree from medical science after cardiovascular research, followed with internal medicine residency program in Tennessee and internal medicine private practice in California. After that, forensic psychiatry practice in California, and now conducting health presentations to help people with medical and mental health problems. Human mind can be compared to a sea that is usually calm, but it can also turn into a stormy sea. When emotions are triggered, they can become difficult to control and can also start controlling our behavior. When we see 1,000 people dying in one day and hundreds and thousands losing their jobs and loved ones, we can almost talk about apocalyptic dimensions. People don't know what to expect and they're freaking out. Anxiety turns into panic, fear, and depression. How can we maintain emotional health among such situations? Our mind is using a strategy by creating habits, so that we create a habit where we are sitting in a space, the place where we go, people that we're associating with. So we have the need for stability, but at the same time, we also have the need for flexibility. Example, last year, Christmas, New Year's, we spent with festivities, with food and friends, and continued as before. Now we realize that sometimes changes happen, usually when we don't expect them. And the question is, when all of this started with changes, we have to remember that we came perfect out of the Creator's hand and did not realize that happiness and health are dependent on our harmony with the universe. Since we chose the way of independence, we had to find out which risks are involved with it. With fall into sin, everything has changed. Man was full of fear. Adam and Eve already got scared of God and hid. And animals were full of fear, and they ran away. Everything has changed except one thing. Can you think what it is? This is our attitude towards our own health. Get this. Even now, in the 21st century, we subconsciously believe that our health is in the same condition like in a paradise before fallen sin. As a result of that, we treat our health as if it has no limits, like teenagers who are living without awareness of risks. And then they pay dearly with the high accident rates. So when the sin came, changes of our emotions happened, and then also was the first failure of our emotions and attitude leading to first murder. But more tragic than killing somebody is realization that someone can be killing himself in ignorance, not even caring for it. You want an example for that? Development of risky lifestyles. We thought that our health is bulletproof, but COVID-19 wants to convince us of different. People never were dying so easily from simple flu and cold. They did not pay attention to these things. But especially those with pre-existing conditions, young and old, can, especially with this COVID-19 suddenly developed very quickly acute respiratory distress. And more than 1,000 people can die in one single day. So we see some numbers here. On April 3rd, globally, there were over 1 million cases. And globally, there were over 55,000 deaths. In the United States at that time, there were 244,325 plus cases. We see example in Italy were almost 14,000 deaths. In Spain, 11,000 deaths, but recovered were about 20.3%. Well, because of the mysterious character of this pandemic, we did not know what to do. And we don't even know when we get infected, when we transmit the infection to somebody else. It can take 3 days before we even have the symptoms. And to top it off, there are no medications and no vaccine for this. Hydroxychloroquine is an old medication used to treat malaria, and it has shown some effectiveness against this virus, especially when combined with Zithromax form of erythromycin. Several groups, I think about over 20 groups, are now working diligently and feverishly in developing a vaccine against the COVID-19. It is an unusual experience that has a very strong emotional effect because its mysterious character. It is dangerous. We don't know how dangerous it is. We don't know how long it is going to last, and it's worse than natural catastrophes, hurricanes, and earthquakes. So because we don't have a clear grasp on this pandemia, anxiety, panic, fear, and depression are very close to us and trying to choke us. They have a very deep emotional effect on us, but especially on those people who are in a quarantine. Now imagine when you're in a quarantine, you're almost like in prison. In fact, in some places, I don't want to tell you where it is, people are not allowed to go out of their house except 3 hours in a week. And those hours are between 4 o'clock in the morning and 7 o'clock in the morning. When you do this, you don't need to go to prison. You have the same conditions almost. People are very insecure and scared. And because of that, fear, worry, panic, and depression are developing. And therefore, it is necessary that mental health professionals be involved in evaluating and carefully treating people. We can see here two groups of involved. One group is people without pre-existing mental health conditions. They are responding in a natural way, trying to protect themselves and get stable. And this group can be treated symptomatically like mental health first aid. On the other side, this group provided good information and proper guidance can be expected to be in condition to manage anxiety, worry, dysphoria associated with the critical pandemic. On the other side, groups with pre-existing condition are different. Interestingly, people that have serious mental illness like schizophrenia and non-affective and affective psychosis are less sensitive towards the effects of catastrophe. They don't get so afraid so fast like the other ones. And those with pre-existing conditions, especially those with mood disorders, anxiety, stress, and obsessive tendencies, are going to show increase in their symptoms as a result of this pandemic emotional effect. In this group, dosage will need to be adjusted. Sometimes maybe added new medication, and the frequency of treatments is going to be adjusted and increased. They need to see their doctor sooner and more often than before. So we have to adapt to the special situation that we are now. We cannot travel where we want. We cannot go and see people that we need to and want to see. Visiting the doctor's office is also limited. Therefore, we have to use visual communications, including telephone, FaceTime, Skype, WebEx, and Zoom. Video conferencing should be used very effectively and frequently to maintain the condition and the contact with our patients. Because the situation is unpredictable, we can see in case of people without pre-existing mental illness, main problem is usually anxiety, and we can address and encourage them to focus on staying in control. Like an example, when you're in an airplane and all of a sudden the cabin pressure drops and you're asked to help somebody else, then you need to first put a mask on yourself before you can help somebody else. So if you're a health professional or otherwise, you need to exactly focus right now and see what is the goal. The goal is to stabilize and control the anxiety. So you look there and see what your goal is. Your goal is to keep calm. And that means, you're focusing and you're dealing with people. And when you stabilize the situation, then you start worrying about your family, your friends, your society. And now more than ever before, it is important to realize the imperative nature of the idea of helping our fellow man. We realize here that our thinking and feeling has its limits. And when this happens, we are out of luck. When you open the TV and watch the news, very often in the last couple of days, I could hear that President Trump and other high officials really did not know what to do next day. They were following the numbers, trying to get some grip on the situation, but they had no control. And now we can realize the importance of spirituality. And this is connection to divine that is independent of our conditions and that can be relied on. It is important to realize that Son of God, Jesus Christ, died for us. He loves us and He is coming soon again. And Psalm 23 wants us to realize that He loves us and He wants to be our guide through the valley of the shadow of death. That has been our experience all along here. And why? Why should we have peace? Because we know that He is our guide and that He is with us. More than ever before, people have a strong need today for social support, for understanding, and spiritual support. Mainly, we're dealing here with two options for survival. That is reducing exposure to the virus by social distancing and hygiene. Number two, increasing our immunity, and this is our next topic. Thank you very much for your attention.